gentlemen, we are about to begin. All right, good evening, ladies and gentlemen. Tonight we'll be going over a disease called colorectal cancer, which is more prevalent among the older generation, ages 50 and above. But it can actually affect you as you get older, as before you even reach the age of 50 or older. All right, what is colorectal cancer? Colorectal cancer is something that starts in the colon or the rectum. It can also be named rectal cancer as well, depending on where they start. Colon cancer and rectal cancer are often grouped together because they have many features in common, like where they start and what kind of cancers are developed out of them, or what kind of cancers they're labeled as. All right, there are different types of colorectal cancers, and there are generally multiple kinds of cancer. And a few of the less common types of colorectal cancers include primary colorectal lymphomas, gastrointestinal stromal tumors, lymphosarcomas, and melanomas. Primary colorectal lymphomas are cancers that develop in the lymphatic system. Gastrointestinal stromal tumors develop in the gastrointestinal tract. Lymphosarcomas are the ones that develop in the smooth skin and melanomas are pretty much skin cancer. They develop along the skin, surface of the skin, develop in the surface of the skin. Right here is a picture of what your intestines look like, small and large. You have your large intestine, which is broken up into three different sections: ascending, descending, and transverse segments. And then in the middle, you have your small intestine, which is something that is like 5 to 10 times longer than your large intestine. And in one of these pictures, it also gives you an example of what a polyp is, which is how the cancer begins. It begins with some kind of polyp. Cancer risk factors. Thank you, Mr. Noel, for attending this period of instruction. You didn't miss that much at all. You actually missed a few slides, which you can still recover from as we go and move on. Colorectal cancer risk factors include a lack of regular physical activity. Also include a poor diet that's low in both fruits, vegetables, fiber, high in fat, high in processed meats. And then if you happen to be overweight or obese, have a high alcohol consumption, or use tobacco, that happens to create a larger risk factor for the individual as well. Demographics: how common is colorectal cancer? Well, colorectal cancer is the third most common cancer diagnosed in both men and women in the United States. Colorectal cancer risk statistics in 2019. 101,422 cases were developed of colon cancer, and 44,180 new cases were developed of rectal cancer in 2019. Overall, the lifetime risk of developing colorectal cancer is about 1 in 22 for men, for men, and 1 in 24 for women. This risk is slightly lower in women than in men. It's actually there's like a 0.34% difference between men and women contracting this disease, colorectal cancer. 51,020 deaths have been attributed to this disease in the year 2019 already. The overall death rate has continued to drop. Deaths from colorectal cancer among people younger than age 55 have increased 1% from 2007 and 2016. It's not a very large increase percentage-wise, but it's still there. The risk of getting colon cancer increases as you get older. More than 90% of cases occur in people who are 50 years or older, 50 years old or older. Other risk factors include having inflammatory bowel disease such as Crohn's or ulcerative colitis, personal or family history of colorectal cancer or colorectal polyps, or a genetic syndrome such as familial adenomatous polyposis or hereditary non-polyposis colorectal cancer, or other words referred to as the Lynch syndrome. All right, how did I do?